scenario is blood transfusion. And this is the next note that we found. A nurse is caring for a patient in need of blood transfusion. Blood product was ordered by the doctor and a consent obtained, but witnessed by the nurse. 2 large bowl IV has been placed by the nurse. UAP brought the blood in a cooler, basically. A Y connector has been primed and ready to go. The nurse and the MD both educated the client about the purpose of the blood transfusion and associated complications. All I've told you is basically what are the things you will do when you get into to have blood transfusion. I've not give you anything, but I've given you information. Patient need blood transfusion, or the preparation you have to do to go to get the patient ready to get a blood transfusion. What is the question? Like I said, this is a bunch of information, but what is the question asking you? Select the most likely symptoms associated with the blood transfusion reaction. Item can be used for more than one column. All I'm saying is all the things I've said here, you don't need it. Patient needs blood transfusion. And I've given you complications about blood transfusion, okay? And then which of these symptoms will be consistent with that? That's all. And that is what the questions would be. There will be a bunch of information you may not need. You just have to realize you said, okay, ignore them and answer the question you're being asked, just to distract us. So the question, exactly what is being asked, is select the most likely symptoms associated with the transfusion reaction. Item can be used more than one in a column. And so this is what the question, the actual question being asked, okay? So I've given you things you should know by now if you're getting to take your exams. And some of the blood transfusion reaction you should know. There's something we call hemolytic and febrile non-hemolytic reaction. There's acute hemolytic reaction. There's allergic reaction. There's anaphylaxis. There's something we call trailer. There's something we call torco, but we're not talking about them, okay? We're talking about these 4. So you have to know the difference between them and to be able to answer them. And so we were going to go through all of them and you can see which one it belongs to. And febrile illness is the most common one that you get in blood transfusion. It's a type 2 anaphylactic reaction. And it's not allergic, but it's type 2 because it is due to antibody and antigen reaction, but mostly for the leukocyte on the individual blood. So sometimes if you immunocompromised, you get leukocyte reduced so that you don't have fever reaction. The way to manage them is to stop the transfusion, notify the doctor, and give them some Tylenol. So the febrile illness is a type 2. So we go down the list and then we'll answer the question. So type 1 is usually associated with the IgE, okay? IgE, that is immune-mediated allergy reaction, basically, and is due to histamine release from mast cell. And therefore, you expect that to be common with allergic reaction, okay, and anaphylactic reaction. Type 2, I told you, is antibody-antigen reaction. If you occur with the individual leukocytes, is a febrile. If you occur with the antigen antibody on the blood cell itself, it's acute hemolytic. So these 2 are together, and these 2 are together. Okay. Attack to the donor leukocyte. I told you the white cells being attacked is due to the febrile illness. And in fever, you can figure it out because this is usually involved febrile and hemolytic. There's type 2 hypersensitivity, and with attack to the leukocyte, yeah, this will have fever, okay. And then the acute hemolytic people, they can also have some fever. Hives and Urticaria, yes, you expect that because it involve IgE response, which is allergic response, and anaphylactic. Anaphylactic is the severe form of allergic response. Bronchospasm, yes. So bronchospasm is very, very important. Like I said, anaphylaxis is usually severe form of allergy, and you don't get in the febrile non-hemolytic or hemolytic. You don't get it in allergy. If you see allergic reaction from blood transfusion with bronchospasm, we call it anaphylactic reaction. Deficiency in IgA. This is very, very common in anaphylactic. Most people have anaphylactic reaction from blood transfusion. They have deficiency in IgA. Therefore, you have to make sure you check the patient. You do all this lab work before you do the trial. That's what they do with cross-matching and other things. So that's anaphylactic. Dyspnea. That means you get to the point that you're having airway issue. And you can think like it does not occur with febrile, no acute hemolytic or allergies, mostly anaphylactic. You have anaphylactic reaction. Tachycardia can be broad. Okay, tachycardia. Patient when you're febrile, your heart rate can go up. Okay, it's common. It will happen. Acute hemolytic anemia, you may have a little bit of tachycardia because of the anxiety. Allergic reaction is also possible. So you can see them. It's non-specific for all of them. It's more common with the anaphylactic, right? You can see in all of them. Back and chest pain, you can think about it. You should not see that in an anaphylactic reaction. You should not see it in allergic. You should see it in hemolytic. This is classic for hemolytic. They have hemolytic reaction. The cells are being destroyed by the antigen-antibody reaction. If the cells are being destroyed by antigen-antibody reaction, you release your hemoglobin into the system, and the patient can become jaundice, or they will have hemoglobinuria. So this is common with acute hemolytic reaction. Any itchiness, pruritus, what do you think? More common, that means you're having some allergy reaction to the blood. So this is very common with that. Like you say, anaphylactic is severe form of allergy, and an acute hemolytic is severe form of febrile illness. But you have to be able to distinguish between them when you see them. How do they look like? Key features for each of them. What are the key features for febrile non-hemolytic? Is non-specific, like tachycardia. They may have fever. That's the classic for them. And they have headache, flushing, chest pain, which is a type 2. Acute hemolytic. Usually there's interaction between antibody and antigen. They can have fever, they can have hypertension, tachycardia, they have back pain, chest pain, and jaundice. Allergic reaction is due to histamines being released from the mast cell. So they have urticaria, they have hives, pruritus. Treatment is just antihistamine. But if it's really getting worse, they develop bronchospasm, hypertension, tachycardia, respiratory distress, dyspnea, all of them is anaphylaxis. So this question is designed to give you good content in a very short time, giving you all the reaction that occur with blood transfusion, except to that I've not done. Take care of yourself. Once again, Adapt NCLEX is your home for next generation. Subscribe to the channel, and so that and put on your notification. You get more of this if you're going to take next generation questions, or you're taking the current generation questions, and I'll give you content that you need. Take care of yourself, and all the best of luck. Bye-bye.